Hi, I'm Aditya from Team Rocket, and this is MedIQ, an AI-powered health assistant that basically helps users understand the medical reports and health symptoms. So, health information is often difficult to understand. This is especially true for elderly people, since a health or blood report obviously usually contains many parameters like cholesterol level, glucose, hemoglobin, other medical values. And for everyday people, especially elderly people, these numbers can be confusing at best and panic inducing at the worst case. And for elderly people, this report might be interpreted as an emergency report when it actually isn't. The opposite can also happen. Sometimes something important might be ignored simply because the report is too difficult to understand. So, for most people, these numbers do not immediately tell us whether everything is normal or if something needs attention. So, another situation many people face is when they experience symptoms like dizziness, fatigue, or chest discomfort. It can be difficult to know what these symptoms might indicate. Sometimes it might maybe something mild like dehydration, while other times it could be point to a more serious underlying issue. So, this is where MedIQ helps. So, MedIQ is basically built around the idea that health information should not feel confusing or be inaccessible. Instead, it should be something that people can understand without needing medical training. So now I will log into my MedIQ account. I've already signed up, so I will log in with my pre-existing email ID. So I will enter my password and I will access my AI dashboard. So this is our AI dashboard for the MedIQ after signing in. So now I will go to my health vault, which is my clinical document portal. So now this here is where I put my report and get what the situation the I might be in. So suppose I put my report, which is this one, blood glucose, this all of these values I have for blood glucose, HbA1c, systolic blood pressure, SO, all of these LDL, HDL. Now I have two options. Either I can drag and drop the medical report PDF, or I can manually in write type the values here and save and analyze my record. So I am doing the former one. I'm going to drag and drop the medical report. So here is my patient report. I will open it. I will click Save Analyze Record. So see, our record is saved to secure vault and MedIQ analysis has been completed. So our AI diagnostic is inside is basically showing us hypercholesterolemia, high cholesterol, which is a moderate risk assessment. So our clinical indicators are also written here. The elevated LDL, low HDL, triglycerides, and early stage atherosclerotic plaque markers, all of those. And I can also download my clinical report here, which if I can open, uh, so now I can go to my health to a dashboard again, and I can now look at my symptom check. So where I can launch neural diagnosis. Basically, I can get predicted disease from the symptoms that I've written. So this chatbot basically tells us what the disease might be from the symptoms that the user has given in the text box. So either I can write it manually, the symptom like I am having chest pain, or I can use my biometric scanner, which is basically has the physiological anomalies. Basically, what part there is suppose certain pain, pressure is. So suppose I choose for chest. So I feel pain in my chest. So I can edit it. I feel very high pain in my chest. I feel nausea. So let me run the report. And this is a
Red Circle Emergency Alert asterisk based on your symptoms, please seek immediate medical care. AI Clinical Report. BMI, 32.8, obese. Most likely condition, heart attack. Risk factors.
So now we can basically see when I wrote my symptom here, the very high pain in my chest and I feel nausea. So now obviously based on the patient weight, height, it can calculate the BMI, which is obese, and the most likely condition it obviously came into is a heart attack because my BMI is high and my then the chest in my pain is very high, and also I feel nauseous. So it's the AI is basically giving me an emergency alert based on the symptom, which is a most likely condition, which is heart attack, and it is given the risk factors. Obesity increases cardiovascular risks, and what medication I can take. Basically, medication currently not we cannot take for cardiac arrest immediately. So it's basically medication. It's saying emergency cardiac protocol, and I can also download the AI report for this. So now I can log in again, and now I can go to my safety lab. Basically, there is issue of taking. Suppose we are taking two medications for the same uh, for treating the same disease. So in a situation where people often face where managing multiple prescriptions and taking more than one medication at the same time is can all or not always be obvious to the patient, like whether those two medications can cause a nullifying effect or it can cause a hazardous effect. So or it might reduce the effectiveness of the medicine or even lead to unwanted side effects. So because of this, MedIQ also includes a feature that allows user to check potential interactions between the medications using the safety lab. So basically, I can put my medication, which would be ibuprofen, and then NSAID medication, and my naproxen, and another NSAID medication, and I can check the drug safety of while of taking both of these medications. So, see, we have found an interaction, and it is saying that taking two NSAIDs together significantly increases the risk of gastrointestinal bleeding, ulcers, and kidney damage. So the recommendation is basically using only one NSAID at a time, or consider Dr. Pollinus. So from both these medicines, our drug safety checker is basically saying that we do not need to take both the ibuprofen medication because it causes a very hazardous side effect. Instead, we can take either one of them, either ibuprofen and naproxen. So uh, now I can go to my account, and in an account, I can actually edit my profile and edit my profile. Like I can change my email in case I have a new email. I change my gender. I can change the city where I live in, the state where I live in, the pin code I'm in, and my weight also. Suppose I have a weight of 67 now. Suppose I've undergone a weight loss program, and my weight has gone down significantly. So now I can, if I save those changes, my profile has is saved successfully, and now my calculated BMI is from obese to normal. Basically, it updates updates the BMI along with when we update the profile. Now I can also check my medical history here, and for security, we can also check here. So we also have another feature, the SOS feature. So suppose there is a dire situation, like a patient is having a dire situation. So if the situation is not too extreme, so we can basically and but it needs serious medical intervention immediately. So we can basically alert the nearby hospitals near the vicinity of the patient, and will basically send the data or the report that has been accumulated by the AI models when the patient has interacted with those models, and send the report data and or the report to the nearby hospitals or medical facilities. So such that the doctors can immediately assess the patient report and basically treat the patient accordingly. We're gonna click this, we broadcast the alert, and there's emergency, and basically the signal has been sent the nearest facilities. Another feature is the request ambulance. Basically, in an extreme situation, suppose in a case of heart attack, brain stroke, what we need immediate medical education, medical intervention. So in that case, the ambulance is obviously needed. So we You click on this, the patient can click on this request ambulance, and the ambulance is immediately dispatched to the patient's location. The disease signal has been confirmed. The ambulance has been dispatched and will come in 8 minutes. So this is the MedIQ website that we have built. Our team Rocket has built. I thank you so much. I hope this project is good, and is would be beneficial for people. Thank you. Take care and goodbye.